Hi, and welcome to HIMSS TV. I'm here today with Frank Cutitta, who is a former HIMSS employee, a former HIMSS Global Board member, and a professor at Northeastern University. Welcome, Frank.
Thank you.
Frank has a story to tell because he is still recovering from COVID-19. He originally went into the hospital in Massachusetts in early March. He is now in rehab, and this week is now his 100th day, as I understand from what Frank has said, of living with this disease. Frank, I'm wondering if you can start by telling us your story and how you ended up where you are and what it's been like.
Well, it's an interesting story from my point of view because I think it's the story of tens of thousands of other people that might be going through the same thing right now and not really knowing it. About 100 days ago, I had felt ill. I had some blood work taken, and my wife said, you really should go in and get this checked out at a hospital. She dropped me off in Massachusetts at Newton Wellesley Hospital on a Thursday night. She was parking a car. They immediately took me upstairs. They immediately took me into the emergency area, and they immediately diagnosed that I had something serious, which ended up being COVID. Within hours, they had intubated me, propofol, and put me to sleep, and sent me over to Mass General Hospital, where I began a 100-day journey that I'm still going through right now at Spalding Rehabilitation Center in Cambridge, Massachusetts. So, I was one of the deniers that thought it just was a cold. I swore it was allergies. I had to convince myself that I really needed to go to a hospital. And after convincing by her and having a blood oxygen meter put on my finger at home, it was pretty clear that I had something a little bit more serious.
It's been a long journey, but I'm wondering, when you started, and this was early March, as I understand it, right?
Middle of March, yeah.
Middle. How much was known about COVID then? How much did you know that you feared that's what you had? Or when was COVID first mentioned to you as a diagnosis?
It was mentioned in Newton Wellesley Hospital. It was the first time that I realized that it was the real thing. When I started feeling ill, it was right around the middle of March. I think my wife's birthday party, 60th birthday party, was supposed to be on March 17th, and we had to cancel the venue because we were going to have 75 people there, and you couldn't have any. They just shut everything down. Charlie Baker here shut everything down. So it was apparent to me when I was in Newton Wellesley Hospital that I had totally underestimated what I had. It wasn't even to the point where anybody was required to wear a mask yet either. So it wasn't like I hadn't done something that was mandated. I mean, I knew that was probably coming. But even having spent time in the healthcare media business, it wasn't something that I was particularly sensitive to. But I wasn't nonchalant about it either. It's just the way people were then. And then, when I found out what I had, and when I started closing my eyes, and that doctor said, we're going to put you under with propofol, and we're not quite sure when we're going to wake you up. That was the harsh reality. I did, as I told some other people in the press, I did say that I had to watch the end of Grey's Anatomy episode that was on the TV in my emergency room before they put me under. They let me have another half hour to watch the end of an episode of Grey's Anatomy that I had been watching. So so it was that was when I knew. That's when I knew I had it, and that was the last time I remember anything for 45 days until they started bringing me out, and probably another 10 days or so before I even knew where I was, even after I came out of it. And the lingering effects of what they call milk of amnesia, the propofol.
Did you consider yourself in a high-risk category? Did you have chronic conditions, anything that would make you think that?
Not really. I was 68 years old. So, I mean, everyone goes through denial that when you're 68 years old, that you're in what they call a high-risk category. I considered myself relatively healthy. I could have lost a few pounds. I ended up losing 40 through this diet. So it's
the survival diet.
Yeah, I guess I could consider myself in a high risk category, but it wasn't that I had some kind of predisposition for a disease that would have given me it with this seriousness.
You were living in the Boston area, still are. Any idea how you got it when you think back?
My wife thinks that I got it on an airplane when I flew down to my mother's 90th birthday party. Who knows? Who knows? All I know is that they went the next week when I was supposed to be at the HIMSS annual conference. The next week they all went to taking my daughter on an engagement weekend, and they all tested positive afterward. So
wow.
I don't know if I could take the credit or the blame for that, but all I know is that they got it. None of them ever got sick, but one could suppose that I had my DNA on there showing positive.
I hope they're all recovering.
They all have, and they showed negative antibodies and everything else, whatever the test is. So they survived and were healthy and became the angels and warriors that helped me get through this.
You were an employee of HIMSS, a professional. You know about how healthcare works. I'm wondering if you can talk about the switch from observing healthcare, writing about it, to becoming a patient, the patient experience that you had.
Well, there's some glaring things that you see, and then there's some subtleties that are specifically related to the virus itself. Because of the nature of the virus, patient engagement is totally different, or lack of patient engagement has to be totally different than if you went in for a knee replacement or something like that. So my experience is related to what a patient is with this virus and how they have to deal with the isolation that's related to it from the caregiver's point of view and the continuum of care that you see being given to patients like myself. I was aware of all the buzzwords that we talk about with workflow and interoperability and all those kinds of things from my writing and my work at HIMSS and my board days. But the shocker for me was seeing how prevalent it is, through nobody's fault really, other than maybe people who fund the organization sometimes, because it's a business. You write for healthcare finance. There's a finance aspect to this that you can't ignore. But when you see how the patient with this disease has to be treated differently than other patients, mainly because of the contagious nature of the disease, it was shocking for me. I had been in for an Achilles rupture. It's not that I hadn't been in hospitals before, but this was really eye-opening. And again, I came to learn, even since we spoke the first time, Susan, that I came to learn that it isn't only the patient that faces these. If you look at the quadruple aim that we talk about in this business, it's actually the provider, the nurses, and the clinicians themselves that are facing some of the same challenges that I did, because this has only been around since March.
Yes.
January at the earliest, unless you're in China. So a lot of these people were hoisted into going from oncology and other practices that they were in and brought in to this COVID environment. And so, I talk about in my writing and in my interviews, I talk about the loneliness that happens because of this, because you're isolated. In some cases, the doctors are only allowed to talk to you for 10 minutes.
Because of time constraints that they don't have time?
And because they don't want the doctors to get contaminated. And many of the doctors that are the best of breed that come in to do this, that are bold and brave and take their life in their hands, a lot of these are used to working in a cancer unit where they've had an intimate relationship with the patient from day one to day 0 where they died. So they're, for them, I thought it was just me that was sort of selfishly lonely, because I spent a lot of time alone and my family couldn't visit me.
That must have been tough.
But I talked to the doctors and they said, "You think you're lonely? We're used to being engaged with patients, and now by order we're told that we just can't do it." And many of the nurses said, "Once I went onto this ward, I lost all my friends."
Oh, because nobody would come in contact.
Nobody wanted to. And still, to many of them, They still haven't re-engaged with their friends. So it was sort of an interesting thing where it was like, the pity party for me. And then I learned that other people had another "oh, woe is me," that unless you put yourself into quarantine for 25 days and work in this unit, you're not going to be able to work here, and I'm not going to be able to make my mortgage payments. So this is really a sort of an epidemic of itself, of an epidemic of loneliness in a way, where people, not only the patient, and I went through it a lot. I mean, I had to bring in help because I spend 23 hours a day with no one to really talk to, except for people changing my tubes and scurrying out. And
what's the toll of that? Did you feel depressed? Was it the behavioral issues?
No, I was definitely depressed. And you probably know me, and I know my colleagues at HIMSS know me, that I have sort of a schizophrenic ADHD professional personality where I do a lot of things. I have a lot of interests. So coming in and being isolated to that extent, and not during the early days, all I could eat was ice chips. I couldn't even have whole food, and stuck in a bed, having to have someone care for you all day, but not really being able to sit down and talk with you. So yeah, I did. I'm not embarrassed to say that I did have to say to people. My wife said, you're an active guy. It's not like you don't have friends, and you're not swamped by people that surround you on a regular basis. So yeah, I had to talk to people, and I did have the good fortune of having a social worker who works here at Spalding, who is really the all-star. That really did what needed to be done. He just actually just sat down, as low tech as you could get. It's not telemedicine. Telemedicine creates the illusion that you have an intimate relationship. And it does to a certain extent. It's better than nothing. I couldn't survive without FaceTime. But telemedicine has also become swamped. People did 40 of these telemedicine calls a year, and now they do 4,000.
Yes.
In a month. So the landscape has changed. So the system, isolation and loneliness has been institutionalized in many providers, and that's what I think one of the biggest awarenesses that I have is that it's really shocking how lonely the people that have this disease can be. I'm lucky because Massachusetts and Charlie Baker, our governor, let us have visitors about a week ago. If you're under certain conditions, you can have visitors come in. So after 70 days, or maybe it was even more than that, my wife and kids could come in and visit me. But people around the country aren't going to be so lucky because they're not at that stage of evolution that Massachusetts is. So the people in Texas and Florida are going to go through this institutionalization of loneliness and anonymity, the people wearing masks so you never really get to meet or know or see their faces up.
Well, that's what I wanted to ask you. They wear masks, so even the healthcare providers look anonymous, I imagine, after a while.
Totally.
Any recommendations about that?
Well, I mean, I've kidded around, and this is not any great invention, but I've told people, I've had one that did it in one of the hospitals that I was in, that they should have like a selfie picture on their hat or on their schmuck or something like that. So somebody could see them. I even to this day, I mean, there's people that cared for me 2 or 3 times, and I have to ask them who they are because they changed their mask and their headdress on there. So it adds to the loneliness because you just don't, when you have to ask somebody who they are, it's coming in and doing very intimate things for your care. It's really, really frustrating. And they get to see me. The ironic part is that in my room, unless I go out on the floor, in my room, I don't have to wear a mask. So they all know Frank.
Yeah.
But I know, I've gotten to know the other ones. I don't want to exaggerate, but those are the kinds of things. But the ones that you get to know the best are the ones that will just sit down and say, they know I'm a foodie. And so some of them will just want restaurant recommendations and sit down or stand next to me for a half hour that don't have to go on the rounds. Others, I write in my previous life about healthcare personas. So what the different personas are of healthcare technology buyers. That was sort of my specialty, is the neuroscience of healthcare buying. I've come to see the personas of clinicians and nursing professionals, and the ones that come in through no fault of their own. It's just the way that their job is set up. Some that come in and just change the bags, or they give you an injection or something like that, and they're done for that part of their job. Then they have to go on and talk to the other 5 patients they have. If 3 of those patients are corona patients, they can't even really, from an administrative point of view, stay that long. Some of them don't care. Some of them just don't care. And the ones that I never got to meet, that my wife and children know, in the ICU, none of them know. We know none of them. They put their lives in risk at the most dangerous time with their masks and everything. And they don't know. They know who I am. They still ask about me, but I have no idea who they are. The anonymity that they have for what a critical part they played in my life is only my family knows.
I imagine you're a rarity, because I've heard that 90% of people who are put on a ventilator and intubated don't make it, and you're the lucky 10%. Do you know what got you through? Was there anything that made the difference? Was it luck, chance, care?
I think it's I'm not a religious person, but I am a spiritual person. I really think something that my family did and my support group. I mean, people in HIMSS know that I had a long career in the media business around the world. My family was just absolutely amazing. So it had to be them. I mean, to the extent that they would put on the Beach Boys and Pavarotti and have the nurses in my ICU unit when I was nowhere close to being out of the coma and just play my music for me.
Did you hear it? Do you remember hearing it?
I don't remember anything. They call propofol milk of amnesia.
Yes.
And that's what keeps you under. So even after I woke up, they tell me about things that I was squeezing their hand and smiling and doing things. I don't remember any of that until I can't remember what the day was where I started really not being loopy. But my family was, just work with some of the best people in the world at Mass General. They had another specialist who came in and got involved. It really wasn't on my case, but sort of a friend of our family that said, part of it was just that he said, just don't shut him off. Just throw the sink at it. And if he passes, then he passes, but it's not going to be because we didn't try every single thing.
Yes.
And they did. And something happened. And, I ended up with certain handicaps that I'm overcoming right now in rehab. And this Godzilla of pneumonia, as my doctors call it, that attacked my lungs is really where the major damage is done. And I've just this week, I'm just getting past the worst part of that and being taken off of some of the antibiotics that'll be for that. But that was the killer, and I think that's where most of the people who didn't make it through, it's probably because of the respiratory issues. As opposed, you could overcome the physical issues, but if you can't breathe,
Right.
So I was very fortunate, and I know as a fact that somewhere in that equation, my family was deeply involved, and the amazing angels at Mass General in that ICU unit. When other people were, taking the easy way out in their medical careers, they jumped right into the fire. In the worst possible place, literally taking their life in their hands. So, when you have caretakers like that and the prestige providers, not that Mass General is not the only one, but it is a pedigree organization. There's something that tells you that something in a rural hospital just might not have been able to pull the same thing off. And look where it's happening now, right?
Yes.
Look where it's happening. I mean, I look at myself as a healthcare journalist, and I say to myself from a writer's point of view, people not nearly as lucky, and people having to travel 40 or 50 miles to get to the closest rural hospital, not even a teaching hospital. So it's there's a lot of good fortune that I've had, especially by living in a Boston area.
Yes. I understand you may be going home in a couple of weeks, and that you also plan to write a book about your experience. And I'm wondering, in the book, are you going to have a chapter on what I'd like to tell healthcare providers and about everything that you've learned, interoperability, patient experience, or anything else that you can say, look, I was the patient, this worked, this didn't. I want to enlighten you on this.
Yeah, I think that they have to look at the anonymity and loneliness aspect as one would look at chemotherapy for a cancer patient. People can visit cancer patients, but all the research shows that loneliness is right up there with diabetes and heart disease as a cause of death, especially in the older population. So, I think ignoring that in a situation where you're isolated constantly, in my case, for 68 days or more, is really part of the clinical collaboration experience that we talk about. Part of this is workflow that hospitals still haven't figured out how to give their clinicians time to spend with patients. And they might be easing up on it in some places like Massachusetts, but in other places it's just beginning. So I think that has to be built into that, what I call the institutionalization of loneliness. They just can't do it. In terms of things like operability, the key issues and themes that we see at HIMSS and in other media and organizations, the interoperability aspects are somewhat daunting. The EMR aspects are somewhat daunting. Writing records of patient engagements, I found, is a really interesting thing, that the people who spend the most time writing the most detail for their patient engagements and what they were experiencing with their ailments are the ones that sometimes get read the least, because people want the easy way out and they just don't want to plod through detailed notes on what people have. So I've had some cases where it took me almost 2 or 3 weeks to get somebody to read somebody else's notes and say it's okay to give me an ice chip. And that's exactly what it was. I was told that I couldn't have ice chips, that I just had to keep this dry mouth. So those kinds of things, constantly on a day-to-day basis, the updating of records. This isn't a slam on the hospitals I'm in. It's just the way it is. When the pipeline goes from the doctor saying you could have a change in your medication and things like that, and when the worker bees actually get it, actually implement it, can be dicey. So that part of the that communications exchange from different levels between the doctors and the clinical people can be somewhat lethargic. In terms of technology, which is what we all write about, yes. Actually the technology is pretty straightforward. I had CT scan today and things like that. This is not. The vendors that HIMSS deals with are every day in my life. I haven't seen anything, although I haven't seen behind the scenes. I'm sure some of the doctors that I have, because of the nature of the institution, are using artificial intelligence to scour records around the world. But the interesting thing about artificial intelligence is based largely on history, right? It goes through a historical perspective. When you have a disease that's only months old, you don't have a very good baseline, a data baseline to draw from. So all of my doctors are very open in saying that we just don't know, and we're hoping you'll tell us. So many of people in my situation are guinea pigs in a good way, because there's just no knowing. And we all see the people we hear about the people that are dying.
Yes.
We hear about the people that are that have just had it like a cold, that have survived it. People like myself are somewhat in the middle, where it's a very angry disease that has very disastrous effects. So fortunately, my brain, some would argue otherwise, fortunately, my brain is still working to capacity. I don't know why my brain dodged the bullet. Some people weren't so lucky. But the debilitating part of it from your lungs and some of my lower extremities, I don't think people get to see that very much. Do you see the clap outs at the hospital? I had one at Mass General.
Did you?
And
they clapped when you left?
They do, because they take great pride in bringing somebody back to life. They quite literally. There were about 30 people at the door And then my family was out there holding signs. It's the first time they got to see me in the open air, although they couldn't visit me. Still, yeah, they got to see me. So you see the clap out, and everybody gets excited on the news. It's a survivor, but you don't see what it takes to get through the 100 days, and it's really freaking hard work.
Yes.
This rehab, not the auto crash victims and people like that don't go through the same thing. I used to watch it for the 9/11 victims here in Boston, for Spalding in Charlestown. And I heard about Spalding being like a Marine Corps recruiting station where they'll torture you to get you better. I didn't realize the hard work. I didn't realize the hard work that goes into just relearning how to walk as a result of this ugly disease.
Well, Frank, we're so glad you're on the mend, that it looks like you can see your way home in a couple of weeks, and that you'll be writing this book that I know I'll be anxious to read when it comes out. So thank you for talking with us. It's been very enlightening, because as you said...
Thank you for giving you and the HIMSS audience my time and to tell my story. And everybody, wear a mask. Wear a mask.